helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm Hattie Cheek. Today, we're talking about something that we never have talked about here on Moms Every Day. Dr. Paul Ferguson from Cabell Huntington Hospital is here to talk about MS and, how many people face it, what it is, all of those things. But let's start with, what is it exactly?
So MS, or multiple sclerosis, it's an autoimmune disease. Autoimmune means a condition in which your body attacks itself. So MS is a condition where your own immune cells, your body's defense mechanism against infections, things like that, attacks itself. It attacks the brain, the brainstem, the spinal cord, even the optic nerves.
And I have to imagine it is as bad as it sounds. That's not something when you hear that you have MS, it's got to be something tragic for that person. Now, how prevalent is it?
So MS is pretty prevalent. In the United States, there's approximately 400,000 people diagnosed with the disorder.
400,000 people who essentially their bodies attack themselves.
That's correct.
Wow. I mean, what are the symptoms? What should you be looking for?
So multiple sclerosis symptoms are wide-ranging. They can start with vision problems, which may affect one eye greater than the other, like a blurriness symptom, or almost like you're looking through dirty dishwater. It can be double vision, could be weakness on one side of the body, sensory change like numbness or tingling on one side of the body, even discoordination, clumsiness.
So, but it's mostly in like the feelings and then your vision. Is that it's not necessarily you just don't feel well all the time?
That's correct. Now, multiple sclerosis is associated with some other symptoms that are common, such as fatigue, maybe decrease in attention, concentration. Right. But generally, the neurologic symptoms that are associated with it are weakness, sensory loss, discoordination, or changes with your vision.
Now, when you hear the fact that it's your body attacking itself, you have to wonder if there's any way to get better. Are there effective treatments?
Absolutely. There are effective treatments for multiple sclerosis. The condition can be treated when somebody comes in with new symptoms with steroids, which are generally given through an IV.
Okay.
In the long run, we manage the condition with what we call disease-modifying therapies. So these are medications that are designed to decrease clinical symptoms or relapse rate, the amount of new MS symptoms that you develop, disability associated with the condition, and changes on your MRI.
And it's got to be tough on everybody, but now you lead a multidisciplinary MS treatment program. Tell us a little bit about that. What is it?
That's correct. So multiple sclerosis is often best managed with a combination of people who are experienced in taking care of patients with complex needs of this disorder. In our clinic at Marshall University through Cabell Huntington Hospital, we have a variety of different folks involved. We have not only myself as a neurologist, we have an MS-trained nurse. We also have a physician assistant who's been dealing with MS patients for approximately 10 years in the Charleston area, as well as a physical therapist who has expertise in balance.
Okay, and what do you guys really do? Are you working with patients one-on-one? Are you just researching everything?
So we work with patients one-on-one in this clinic. They come in for set appointment times, much like a regular doctor's visit. They're assessed by not only myself, but also the physician assistant, and then some screening and intake evaluation is done by the nurse. We also utilize our balance and vestibular center for people that have those particular needs, and physical therapy as well for patients who have recently suffered an exacerbation.
Now, how important is it to get this treatment as fast as you can?
Well, the treatment for multiple sclerosis, as I said, there's acute treatments, or when you're initially sick with it, with the steroids. That'll help you get better quicker. Okay. The disease-modifying therapies are used to treat the condition in the long run. Okay, so it's sort of like a marathon, not a sprint with this.
Yeah, you have to keep going and keep going. It's one of those things that you keep coming back for treatment.
Unfortunately, it is. There's no cure for this condition.
Do a lot of people end up in wheelchairs?
Used to be that we saw patients end up in wheelchairs all the time. In fact, the average duration from time to diagnosis to wheelchair was around 10 years before the medicine. Now, fortunately, we don't even really have good data on it. Most patients are able to maintain their normal, independent ability to walk for the long term with the new medicines.
Is the lifespan cut at all with this?
No, the lifespan currently is not cut with multiple sclerosis. That is, again, different with the new agents that we've developed over the last 20 years.
And I've got to say, I mean, it must be awful, it must be painful, it must be something that you never want to deal with, but just to hear you say that people are no longer really having to go into wheelchairs and, you know, life's not cut short, that is that makes you feel a little better. That's optimistic about what's happening for the future.
Absolutely. It's wonderful for us to be able to offer treatments that will keep patients independent longer.
Great. Well, thank you so much for joining us today. For more information, you just head to our website, WSAZ.com, click on the Moms Everyday tab, and then you can download our Moms Everyday app. We'll be back with more Moms Everyday on Friday. You have a good day and enjoy that weather.